All right, everyone. Continuing now, I'm gonna start on the more clinical presentations of the complications that diabetes can cause if it's not controlled. It's mostly hyperglycemia that'll do this. So prolonged exposure to hyperglycemia has a lot of effects on the body, and it typically starts just because of one basic thing. It's one basic concept. And that concept is the accumulation of glucose in our blood vessels, okay? Now, I don't want you to think about your ascending aorta, your carotids, and your bigger arteries only, because yes, we do know that you could get carotid plaques, all right? And they could affect your baroreceptors and chemoreceptors by the internal and external carotid bifurcation. And can cause some clinical manifestations, but those are easy to picture. What I want you to picture now are the small capillaries and the small arteries, the microvasculature of the body, and how they get affected. Because if a plaque can build up in your carotid arteries and really cause some real bad clinical manifestations, syncope, orthostatic hypotension, because your baro and chemoreceptors aren't working and functioning the way that they should. Imagine what it could do in the much smaller circulation. You know, it obviously is devastating to the microcirculation if it could accumulate in such a large artery. Okay, so I want you to pretend that this right here is a smaller artery, much smaller artery, barely visible to the naked eye, and even the capillaries. Okay, that's where exchange happens at our capillaries. So if the capillaries aren't functioning properly, you can imagine that you will get ischemia. Okay. And that is a cause of a diabetic foot ulcer. What happens is a lot of clinicians go ahead and sometimes they feel a pulse. You know, they have a strong pedal pulse, and they think, you know what, they have pretty decent circulation. But you have to remember that this is a large artery, okay, in comparison to the micro circulation that we have. So you could still have an individual with diabetes with a strong pedal pulse, and they could still have a foot ulcer, okay? They could very well still have a foot ulcer. I've seen it. I've actually seen it myself, where the individual has nice circulation to most of his foot area, but on the bottom he's having this dark brown accumulation where they try to see if it's an infection. They treated it for infection. Nothing happened. It didn't go away. And he still had that formation of what will soon be necrosis, because it wasn't necessarily necrosis just yet. It wasn't completely black and completely dead, but it was pretty much getting there already. So you can't have a diabetic foot ulcer even if you have a strong pedal pulse, okay? That's something good to keep in mind, because a lot of diabetics will present with diminished pulses in their extremities, and you could tell from far away that they have bad circulation. They'll have, since they don't have good circulation all over this place, they don't have nutrients getting to a lot of the cells, and you'll see it superficially. You see that they'll have a less hair or no hair at all, because hey, they're not getting nutrients. Why would the hair follicles, where are they getting their nutrients to be able to create the protein that they need to create those hairs? So you will have loss of hair there. So you also feel warmth because you're not having good capillary exchange. So a lot of that nice warm red blood that came from the core of your body will basically be accumulating. So you will have a red and a more warm extremity. And you could always have a tender extremity, whether it's venous insufficiency or arterial insufficiency. You could definitely have pain in both. So that's one of the effects that diabetes has. Okay, now I want you to understand clinically that these arteries do get basically clogged. Okay, not only do they get clogged, but they get harder. They lose their ability to dilate. They lose the ability to exchange things at the capillary point of view, all right? So permeability is definitely affected. But I want you to also remember something. In the lumen of our blood vessels, the intima, right there exposed in the intima, in the lumen of our blood vessels, we have, for example, heparin, which holds antithrombin 3, okay? Now, heparin is naturally occurring in our body because, you know, red blood cells all the time crash against each other, get damaged, they interact with platelets, and coagulation can happen in our body at any time. It's happening right now in your body. Coagulation is a normal thing. Now it's happening at such a small rate that it doesn't affect us. You don't walk around and you see people having strokes left and right because we have heparin, among other things. We have heparin being exposed in the lumen of our blood vessel, and this heparin holds antithrombin 3, which cuts apart the thrombin formation. Okay, so another thing that we have is a nitric oxide, which is released, and it helps with the flexibility and dilation of our arteries. So what happens is that we don't only get hardening of our arteries, and we don't only get blocking of the permeability of our little arterioles and capillaries, but we also have an increased risk now of coagulation, because we are now not only hardening the cell, but we're blocking some of these proteins and some of these molecules that are being presented, presented by our cells, by the lumens of our intima and the arteries, and they're not doing their job. So you have an increased risk now in that area for coagulation. And if you have an increased risk for coagulation there, well, guess what happens? Now you have a higher risk of ischemia in this extremity over here. Okay? So that's the understanding of how the microvasculature can be affected. Okay, so once again, just because you have a good pulse doesn't necessarily mean that you have good microcirculation. Okay, that's one of the effects of prolonged hyperglycemia, and of course, high cholesterol has very similar effects to this. Okay, why does this happen? Why does this plaque build up? Well, the same way that it happens with cholesterol, a high amount of anything in our body is seen as abnormal. Okay, every single cell in our body, or most of the cells in our body, have MHC receptors and other receptors that our immune system, like the thymus that trains our T cells, are trained to recognize these receptors as our normal receptors. What happens is, when you have an excess amount of anything in the blood becomes a little more viscous, but not only that, but it promotes the accumulation of all this junk in the intima of our arteries and of our vessels. So what happens is that this accumulation causes inflammation. Okay, this accumulation here also hides the MHC1 receptors, which are receptors. They're little flags saying, hey, listen, I'm part of this human body, don't attack me. So now what happens is that you're promoting inflammation. So you have macrophages and T cells that go to the area, and they start attacking this inflamed tissue that's filled with all this plaque, that at this time now it becomes plaque basically. And all this just increases the amount of scarring to this tissue. Because whenever we have an injury, eventually the end result is scarring. At least hopefully it's a scar, because the matter will just keep on spreading. The inflammation will just keep on spreading. So that's how scarring, that's how atherosclerosis leads to arteriosclerosis. Okay, hardening of plaques, atherosclerosis, and arteriosclerosis, hardening of the actual arteries. Okay, this is also true for our venous circulation. However, our venous circulation, for the most part, is more abundant than our arterial circulation. For every one artery, we have approximately 2 veins. Sometimes we even have 3 veins for one artery. So this also happens at the venous side, but the venous side we'll get into in other diseases, CHF and venous insufficiency in other lectures. So what's going on now with microcirculation? We gave you an example of a foot ulcer, for example. Okay, this is a foot ulcer over here. It causes a lot of pain. It's hard to heal. Now you're increased risk for infection because you're not getting nice circulation to the area. And guess where white blood cells are? White blood cells are distributed through our blood. So if we have ischemia to this tissue because there's lack of oxygen and lack of nutrients and the cells are dying, well, guess what? We're also going to have lack of defense. So that tissue there not only dies, but now can become infected. Okay, our nice little staph and streptococcus, or epidermis, or anything else that you're exposed to can go ahead and infiltrate that area, and you will now have an infection that you cannot control because of the lack of circulation. So wound care is very, very, very important in these patients because of the lack of immunity to that area. Okay, lack of immunity systemically as well sometimes because of the high amounts of inflammation that they could have. Next video we're going to continue with how it'll affect the heart, nervous system, and our vision.